Okay, so then let's talk about and with pulmonary volumes and capacities. So this is a summary of all the volumes capacities, and what's happening here is that again your lungs have volume, and what's happening here, well, it's increasing in volume. So by increasing in volume, this means this person's inhaling, and then when it decreases in volume, that means you're collapsing the lungs, this person is exhaling. So notice that the amplitude, the overall height of these waves are pretty small, and then it dips really low. By dipping really low, that means they're exhaling, right? So what they were doing here is tidal breathing or quiet breathing. So quiet breathing, you are moving in air in and out of your lungs, but not a big amount. But what happened here, they took a big exhalation like that lady in that unitard, the lady in the blue jumpsuit or whatever you call it. So she was like doing that big exhalation, and then what happens here, go back to quiet breathing, and this person right here, they're doing a big increase in volume. So what they're doing is doing a big increase in their breathing and inflating their lungs. And at this point, what they're doing is a big exhalation, exhaling as much air as they can, and then returning to quiet breathing. And this is how you're able to measure that. You use spirometry is often used to measure your overall function of your lungs. So what does it do? Measures your breathing, but it also has a little sensor that detects the velocity of the speed of how much air you're exhaling and inhaling. So this is how it's able to approximate the amount of air that you have in your lungs. Now the thing is that you can't measure exactly how many air you have in your lungs without fully collapsing it. Or actually you can, but it would involve another different type of technique. So it estimates lung size because again, if you're just breathing normally and for doing forced breathing, even if you're forced exhaling, you're still going to have some volume left over in your lungs. But spirometry is, again, this technician look at this, it's very small. You can have it in pretty much almost any office. Now, why is it often done? Well, the thing is that respiratory diseases can affect the amount of volume and also the rate of your breathing as well. So things like this laundry list right here, all of these, you can use spirometry to help in the diagnosis of these diseases. Now, it won't be like the only tool that diagnoses these diseases, but it's a very powerful tool. And here's the OpenStax version, and what we see here is that there are various parameters you can measure. So different quantities that I want you to definitely know these for, and also actually these are pretty reasonable lists, so I think you definitely should know how to measure all of these based on one of these spirometry graphs. Now what we have here, so let's talk about 4 of them. So here we have tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. So these are the 4 basic volumes, and these are very important things to measure in spirometry. Why? Because again, things can affect their overall, by measuring these volumes, they also form the basis of these other measurements as well. So tidal volume, sometimes abbreviated TV or V with the sub T. So this is the volume you move in and out of your lungs during quiet breathing. So it's roughly equal in women and men, about ½ a liter. And inspiratory reserve volume, so this is how much more you can breathe in. So whenever you see that term reserve, just like cardiac reserve is how much more you can increase your cardiac output, inspiratory reserve is how much more you can breathe in. So, or like in the military reserves, they're like our extra troops, right? Or like for this pandemic, I joined the local Hawaii Medical Reserve Corps. So we're not the actual corps, we're the additional. So how much more medical professionals and people you can deploy. So any time of reserve volume or reserve in the body, that's how much more you can do in your body. Now, inspiratory reserve is how much more you can breathe in. Expiratory reserve is how much more you can breathe out. So again, this is forced breathing. So basically, it's the difference between the bottom of your tidal volume and the bottom of when you exhale as much as you can. Now residual volume, this is what air you can't breathe out. So there is a little less left over after you've done your full forced breathing and full exhalation. Now lung volumes, so the interesting thing about lung volumes, by definition, they do not overlap. The border of one is the border for another. So again, tidal volume, that's the amount moving in and out of your lungs during regular quiet breathing. Inspiratory reserve volume is how much more you can breathe in. Expiratory reserve volume is how much more you can breathe out. So again, this can't emphasize enough. They do not overlap, but the thing is that they can be added to form another type of measurements we call lung capacities. So lung capacities can overlap. Lung volumes do not overlap. Now let's look at okay, so to reiterate, this is tidal volume, sometimes abbreviated TV or VT. So again, inhale, exhale, but it's a very small volume over here. So this is your tidal volume. This is during your quiet unconscious breathing. Now what's happening here? So they were doing quiet breathing, but all of a sudden you have a big increase in the volume in your lungs. So are they inhaling or are they exhaling? Well, again, increasing the volume of your lungs, they're inhaling. So by inhaling, this is your inspiratory reserve volume. Common mistake I see, especially on not only in the lecture but lab exam, is they measure from here to here. So the way you measure inspiratory reserve volume, you always for volumes, you always measure peak to peak or valley to valley. In terms of inspiratory reserve volume, you go from peak to peak. So you go from the maximum during the tidal volume maximum, and then you go to this absolute inspiratory reserve volume maximum. For expiratory, just the opposite. So what we have here, tidal volume, this person increased their or decreased their lung volume more than usual. So what's happening? They're doing forced exhalation. And how do you measure that expiratory reserve volume? You measure valley to valley. So this is how you get your well, we should say ERV over here. But thing is that, notice that it doesn't go all the way to zero. And why is that? Well, if you had their lung volume going all the way to zero, you have a pneumothorax on both sides of your lung. So the thing is that your lungs deflate, but they don't deflate all the way. They still maintain some sort of like volume. Because again, remember our alveoli, they're very wet, they're very sticky. Even though you have your surfactant, you don't want them your alveoli collapsing all the way, because it would be harder for them to force your alveoli open and snap it. Yeah, if you press your alveoli walls together, it's going to be harder for them to inflate than if they're partially inflated and try to inflate it even more. So this measures pulmonary ventilation and estimates lung size. So this is why it estimates, because of that residual volume. So the residual volume, again, this is how you measure it. You can't normally collapse your lungs all the way to zero, like no volume in your alveoli whatsoever. So that leftover volume, when you do a full forced exhalation, whatever's left over, that's your residual volume. Now there are other ways to measure lung volumes, like, I don't think I have a slide of it, but sometimes they can put you in a airtight container and measure the pressure inside that container while you're breathing normally in and out of a spirometer. This is called plethysmography. Or you can also do a helium dilution test as well, but I think that's a little advanced for this class.